Sleep is essential for our physical health, mental well being, and overall quality of life. While we often hear about the dangers of not getting enough sleep, there's another side to the coin that's equally important but less frequently discussed, which is oversleeping. It might seem counterintuitive that getting too much sleep could be problematic, but as with many things in life, balance is key. Let's dive into the world of sleep and explore the fascinating phenomenon of oversleeping, its causes, symptoms, and what we can do about it. Oversleeping, also known as hypersomnia, is a condition characterized by excessive sleepiness during the day, prolonged nighttime sleep, or sleeping for extended periods of time. It's more than just enjoying a lazy Sunday morning in bed or catching up on sleep after a particularly tiring week. Oversleeping is a persistent pattern of sleeping more than the recommended amount for your age group, often accompanied by difficulty waking up and feeling groggy or unrefreshed even after long periods of sleep. To understand oversleeping, we first need to establish what constitutes a normal amount of sleep. Sleep needs vary significantly across the lifespan and can differ from person to person. Newborns, for instance, need a whopping 14 to 17 hours of sleep per day. As children grow, their sleep requirements gradually decrease. Toddlers typically need 11 to 14 hours, preschoolers 10 to 13 hours, and school-age children 9 to 11 hours. For teenagers, the recommended amount is 8 to 10 hours per night. This higher requirement is due to the significant physical and mental changes occurring during adolescence. When we reach adulthood, our sleep needs stabilize. Most adults require between 7 to 9 hours of sleep per night to function optimally. This range accounts for individual variations. Some people genuinely need more sleep than others to feel their best. As we enter older adulthood, 65 years and above, sleep needs decrease slightly to 7 to 8 hours per night. It's important to note that these are general guidelines. Some people naturally fall on the lower or higher end of these ranges. The key is consistency in how you feel during your waking hours. If you regularly sleep within your age group's recommended range and feel alert and energized during the day, you're likely getting the right amount of sleep for you. So, when does sleep become too much? Well, generally, consistently sleeping more than 9 hours per night as an adult or regularly napping for long periods during the day in addition to a full night's sleep could be considered oversleeping. However, it's not just about the quantity of sleep. The quality and the impact on your daily life are equally important factors. Causes of oversleeping. The causes of oversleeping can be varied and complex. In some cases, it's a symptom of an underlying health condition. Depression is a common culprit. People with depression often experience changes in their sleep patterns, which can include oversleeping. The relationship between depression and sleep is bidirectional, which simply means that depression can lead to oversleeping, and oversleeping can exacerbate depressive symptoms, creating a challenging cycle to break. Another potential cause is obstructive sleep apnea, which is a condition where breathing is repeatedly interrupted during sleep. People with sleep apnea often don't get restful sleep despite spending a long time in bed, leading them to sleep longer in an attempt to feel rested. Ironically, this extended sleep time often doesn't improve their daytime alertness. Narcolepsy, which is a neurological disorder that affects the brain's ability to control sleep-wake cycles, can also lead to oversleeping. People with narcolepsy may experience excessive daytime sleepiness and sudden sleep attacks during the day, in addition to long periods of nighttime sleep. Certain medications can also cause oversleeping as a side effect. These include some antidepressants, anti-anxiety medications, and pain medications. Sometimes, oversleeping isn't related to a medical condition at all, but rather to lifestyle factors. Irregular sleep schedules, such as those experienced by shift workers or people who frequently travel across time zones, can disrupt the body's natural circadian rhythms and lead to oversleeping when the opportunity arises. Similarly, a lack of exposure to natural light, which plays a crucial role in regulating our sleep-wake cycle, can contribute to oversleeping. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of oversleeping. The symptoms of oversleeping can be subtle and are often mistaken for other issues. One of the most common signs is excessive daytime sleepiness. This isn't just feeling a bit tired, it's a persistent, overwhelming desire to sleep during the day, even after getting what should be a full night's rest. People who oversleep often describe feeling groggy and disoriented upon waking, a state sometimes referred to as sleep drunkenness. This grogginess can persist for hours after waking, affecting concentration and productivity. Paradoxically, oversleeping can lead to fatigue. You might think that more sleep would result in more energy, but the opposite is often true. People who oversleep frequently report feeling lethargic and lacking motivation. This fatigue can be both physical and mental, making even simple tasks feel overwhelming. Mood changes are another common symptom of oversleeping. People who consistently sleep too much often experience irritability, anxiety, and even symptoms of depression. The relationship between mood and sleep is complex, with each influencing the other in a cyclical manner. Physical symptoms can also arise from oversleeping. These may include headaches, particularly upon waking, and back pain from spending too much time in bed. Some people experience muscle aches or stiffness, likely due to the extended periods of inactivity. Cognitive function can be impaired by oversleeping. Many oversleepers report difficulties with memory, concentration, and decision-making. This mental fog can persist throughout the day, affecting work performance and daily activities. Weight gain is another potential consequence of oversleeping. This is partly due to the decreased physical activity that comes with spending more time in bed, but there's also evidence that oversleeping can disrupt hormones that regulate appetite and metabolism. Diagnosis of oversleeping. Diagnosing oversleeping typically starts with a detailed sleep history, where a doctor will ask about your sleep patterns, daytime symptoms, and any factors that might be affecting your sleep. They may ask you to keep a sleep diary for a few weeks, recording when you go to bed, when you wake up, and how you feel during the day. Physical examinations and blood tests may be conducted to rule out underlying medical conditions that could be causing the oversleeping. In some cases, a sleep study might be recommended. This involves spending a night in a sleep lab where various bodily functions are monitored during sleep. This can help diagnose conditions like sleep apnea or narcolepsy that might be contributing to the oversleeping. Actigraphy is another tool sometimes used in diagnosing sleep disorders. This involves wearing a device similar to a wristwatch that tracks your movements, helping to determine your sleep-wake patterns over an extended period. Treatment for oversleeping. Treatment for oversleeping often involves addressing the underlying cause. For those with sleep apnea, continuous positive airway pressure therapy can be effective in keeping the airways open during sleep, reducing the number of interruptions and improving overall sleep quality. For individuals with depression or anxiety, therapy and medication can help manage the symptoms and improve sleep patterns. In cases where medications are causing drowsiness, your doctor may adjust the dosage or switch to a different medication. For many people, improving sleep hygiene can make a significant difference. Establishing a regular sleep schedule where you go to bed and wake up at the same time each day can help regulate the body's internal clock and reduce the need for excessive sleep. Exposure to natural light, especially in the morning, can help regulate the body's circadian rhythms. Getting outside for a walk first thing in the morning or using a light therapy box can be beneficial, particularly for people who don't get much natural light exposure. You can also try creating a relaxing bedtime routine, such as reading a book or taking a warm bath. This can also signal to the body that it's time to wind down and prepare for sleep. In some cases, a technique called sleep restriction therapy might be recommended. This involves temporarily reducing the time spent in bed to match the actual amount of sleep being obtained. As sleep efficiency improves, the time in bed is gradually increased. This can help consolidate sleep and improve its quality. At the end, while occasional oversleeping may not be a cause for concern, chronic oversleeping can have significant impact on overall health and well-being. Now we want to hear from you. Do you or someone you know suffer from oversleeping? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.